Hi, my name is Divina. Today I'm going to present about congenital dislocation of hip. Okay, so basically in babies and children with development dysplasia, dislocation of the hip. The hip joint has not formed normally. The ball loose in the socket and may be easy to dislocate, and dislocation of hip most often present at birth. So because of that, babies or children, they have limitation of abduction. Abduction. They have abduction, so they can't abduct properly. And then shortening of affected limb. So to confirm that they really having dysplasia of the hip, we have tests to confirm it. So first test is symmetry, or a so-called galeazzi. Okay, so it's used for hip dislocation, specifically testing development dysplasia of hip. So the test is performed, okay, infant supine, and then the hip flex to 45 degree and knee flex to 90 degree, like this, with feet flat. So it's like this. Okay, so let's see. Okay, so this test to look symmetry in the level of the knees, and if there's an inequality in height, okay, of the knee, refer as a positive sign. So let's say one leg is it's long, another is short. Okay, so the long one is the positive sign actually. Okay, so you just hip flex for 45 and knee flex for 90 degree. Okay, so make sure the feet flat. Okay, let's see, this is the knee level. This is the long and this is the short, so this side is affected lah. Okay, so that's for the symmetry and galeazzi test. Okay, so next I will proceed to Barlow test. Okay, Barlow test is considered positive if the hip can pop out of the socket. So this dislocation will be palpable. Okay, so for Barlow test, it's very simple actually. Okay, so one hand stabilized in the pelvic wheels, and another grabs the knee and flexes the hip to 90 degrees, like this. Okay. So we just concentrate on the affected side. So let's say after affected side is left side. Okay, your hand need to stabilize at the pelvic over here, like this, and then another hand place like this. Okay, so the thumb is near to the thigh lah, inner thigh, and your forefingers grabs the knee. Okay, okay, from here it's 90 degree, right? Okay, from here give a posterior force applied through the femur, as the thigh is gently like this. Okay, push, give a force, and gently abduct ABD to 10 to 20 degrees. Okay, so you can hold in this position for 2 to 5 or 5 to 10 seconds. Okay, to feel the socket. Okay, so you feel the pop out of the socket over here. Okay, so that's for the Barlow test. So next is Ortholani test. It's quite similar as Barlow test, but if Barlow, there's 90 degree over like this, right? I mean, you need to flex the knee. But for Barlow, for Ortholani, you need to open wide like this. It's in abduction position like this, and then you need to give a force, posterior force also, and abduct 10 to 20 degrees. Okay, so from this position it's out. Okay, so you need to push and abduct a bit. Okay, okay, so yeah, if the hip was dislocated, a distinctive clunk will be heard as the hip relocates. So that's for the Ortholani test. Other than tests, we also provide a device for positioning and mobilization of hip and strengthening of muscles. Okay, we also provide exercises and also devices. So first I will let you know about the device. Example like pelvic harness. Okay, so pelvic harness is effective for children below 6 months. It's a dynamic position device. So it's maintain the hips in 90 to 100 degree of flexion and 50 degree of abduction. Okay, so it consists of a circumference chest strap with the shoulder strap that provides sides of attachment for lower extremity straps. Other than pelvic harness, we also provide hip abduction braces. Okay, so this usually worn after the pelvic harness, after 4 to 6 weeks of introduction of the harness. And okay, braces actually keeps the hip in abduction and limit hip movement, thus help in realignment of femoral head into the socket for normal development of hip joint. So it's usually worn for about 6 to 12 weeks. Okay, so after the hips become stable, the braces is normally worn part-time, usually at night for another 4 to 6 weeks. I will continue to strengthening exercise. First, I'm going to teach you kick the ball. Okay, so for to kick the ball, the first thing is the ball. Okay, and then okay, baby position is supine position like this. Okay, and then you must attract the baby to kick the ball. Okay, so how? So first, place the ball over here near to you, and then hold the baby leg and let the baby to realize to kick the ball, so that it's like something over there, so the baby will try to kick. Okay, so this exercise will strengthen the part of the dislocation area, and yeah, this to improve the range of motion and also strengthen the muscles. Okay. Other than that, we also can do hydrotherapy. Hydrotherapy, hold the baby, okay, or the child, okay, and ask to and place the leg in the water and let the baby to play. It's not play, it's also like kicking, so that there's a movement to strengthen the muscle. So the joint will be moving lah, if you know. So let's say this is the water, the baby will start to play. Okay, so for the next exercise, I'll use Theraband for strengthen the muscle. So place the Theraband over here, over the tight. Okay, make it tight. Okay. So you need, from this position, you need to abduct the muscle. So it's strengthening the muscle. Okay. So we can do this exercise for 2 to 3 sets, and 5 to 10 or 5 to 15 repetition. Okay, so you stretch and hold for 2 to 3 seconds. Okay, if the baby cries, don't force, because maybe it might pain for the baby. So after sometimes, like a few minutes or hours, we will continue back